This video is intended to help the veterinary assistant or technician to become more proficient in handling exotic pet species that are commonly presented to small animal hospitals. This program is limited to the basic capture and restraint for examination, as well as some special procedures will be covered. With time and additional hands-on instruction, you can become a skilled handler of exotics. Major groups of animals covered include psittacine or parrot-type birds, lizards, snakes, turtles, rabbits, ferrets, and smaller rodents. Avian or bird restraint is perhaps the trickiest topic due to their unique anatomy. The parrot-type birds have strong beaks that can inflict a nasty bite. They almost always strongly resist restraint and will flap their wings wildly during handling, which prohibits examination and can cause injury to the bird. Their feet can become very uncomfortable if they grab you. The most important anatomic variation with birds is their lack of a diaphragm to aid respiration. Because of this, great care must be exercised not to impair the bird's ability to breathe. Proper restraint should minimize the pressure applied to the bird's chest area. Always watch the bird prior to handling to assess its health. A very weak, debilitated bird should be seen by the doctor prior to handling. Wash your hands after handling each bird. Common small psittacines presented included cockatiels and budgerigars, commonly called budgies or parakeets. Capture of these pets is facilitated by using a paper towel or such item. The paper towel doesn't provide much bite protection, but interferes with the bird's ability to find a spot on your hand to bite. In many cases, it may be beneficial to first remove some toys and perches that the bird can hide behind. Another trick for small, flighty birds, especially songbirds such as canaries and finches, is to turn down the lights, use a flashlight or otoscope to find the bird, then catch him. Birds will usually not attempt to fly in the dark as they can't see where they're going. An important thing to remember when grabbing a bird is to do it confidently and quickly. In general, you will not be able to sweet-talk a bird into accepting restraint, and the longer your hand hovers around, the more stressed it will become. When grabbing a small psittacine, use your hand or the paper towel to grasp his head-neck area. The paper towel or your palm is then used to restrain its wings while you extract it from the cage. Always have the wings restrained prior to removing the bird from the cage, so it doesn't hurt its wings on the cage door. As with handling all birds, be very careful not to squeeze its chests. Capturing a larger parrot is very similar to capturing smaller birds with respect to respiratory precautions and the need to grab them quickly and confidently. Large birds are more inclined to fight back with biting than to be flighty. A towel may be used to capture larger parrots, as this helps protect from bites, and you can wrap their body in order to restrain their wings. The towel is placed over the bird's back, then quickly grab the head neck, being careful to avoid his bite attempts. Raptors, or birds of prey, must have their feet neutralized, as these are their main weapon. Using thick leather gloves, grab both the shins just above the feet. Then extract the bird from the cage and gain control of his wings with a towel or your hands. Hawks rarely bite, but owls are prone to biting when their feet are restrained. After the bird is caught, he must be held properly for the exam. Several positioning concepts are important for all birds based on their respiratory anatomy. As much as possible, the bird should be held in a normal perching position. Laying them on their back or upside down can push a bird with respiratory distress over the edge, as he won't get enough oxygen. For examination, birds should be held by the head, with a thumb and middle finger on each cheek and the index finger on top of the head. This controls the head and neck. The wings, body, and legs must also be restrained without squeezing the body itself, which must be allowed to move to facilitate breathing. This is most easily accomplished in all but the largest of birds, with the ice cream cone grip. Here, the tail and its base, along with the extended legs and tips of normally folded wings, are held together with your left hand. Notice that no pressure is exerted on the abdomen or chest, and the bird is comfortably restrained. During the exam, the doctor will want to look at the head and inside the mouth. then work down the body. Larger birds, like macaws and birds of prey, must have their heads restrained, similarly to smaller birds. Be aware and inform your clients that holding a macaw's cheeks may cause mild bruising to the non-feathered regions on the cheeks. To restrain this larger bird's body, a towel may be wrapped over the shoulders to inhibit wing flapping, and the feet are secured with your hands, as demonstrated. Bird restraint for examination is usually done as previously described. Birds are weighed on a triple beam balance, like the one used here. Long procedures are greatly assisted by this device, called the Miami Vice. This device, when used properly, is very safe and effective. Birds usually behave much more calmly when restrained like this than by hand. The decreased resistance by the patient is probably due to the bird's sensation that he is restrained by an object rather than a potential predator. The Miami Vice will accommodate birds as small as a cockatiel up to those as large as an eagle. First, place a folded towel where the shoulder will lie. Insert the head into the slot, securing both sides of the neck with the pins. Restrain the wings simultaneously by holding them and then wrapping the towel loosely around the shoulders and breast. The excess portion of the towel can be put under the Miami Vice to keep it secure. The towel wrap is very important to keep the bird from flailing its wings and injuring itself. The foot restraints are looped around the ankles and pulled snugly. Remember that birds with respiratory disease or fluid in the abdominal cavity should not be restrained on their backs to avoid a respiratory crisis. Many procedures are much easier when the bird is restrained in the Miami Vice. Beak, wing, and nail trims and x-rays may be done by one technician and the Vice in many situations. We will demonstrate these procedures on a larger bird using the Vice and a smaller one using manual restraint. We do all beak and nail trims on birds with a Dremel tool and sanding stone. This provides gradual and smooth removal of the keratin-formed structures. Also, the high-speed burr will aid in blood clotting if you go too deep. On a beak trim, the upper and lower beaks are held together. This prevents motion of the head and also keeps the bird from sticking his tongue out and getting his tongue burred down. The upper tip of the parrot's beak normally hangs over the lower beak. Don't try to make the tips meet. Look at pictures of normal birds to get an idea of how they should be, and grind the upper tip of the beak back to a normal position. There may be a thinner rim of keratin around the edges of the upper and lower beak, which should be ground off. Make sure you get the lower beak tip that strikes the upper beak level. Failure to do so can result in a deformity as the beak grows out. If there are ridges of thick keratin plates on the walls of the beak, grind these very carefully to smooth them out. After the beak is trimmed, use a drop or two of mineral oil on your fingers to wipe on the beak, giving it a smooth, shiny appearance. But be careful not to get any oil on the feathers. Smaller birds' beaks are trimmed in a similar fashion, although the bird is normally restrained manually. Just like holding for an exam, the cheeks are held with a thumb and finger. The legs, tail, and wings are held like an ice cream cone. The trimmer can hold the beak and can use a cotton tip applicator to hold the mouth open and keep the tongue out of the way. Many birds, and especially the smaller ones such as parakeets, won't develop overgrown beaks unless they have some underlying illness such as beak mites or internal disease. Liver and some endocrine problems, which are potentially fatal, can produce overgrown beaks. Check with your doctor on how to handle these patients and clients. Capturing and restraining these birds could result in death due to the underlying problem, which the owner may not be aware of. Dealing with this issue before a catastrophe is much easier than trying to explain to an upset client how their pet died during a procedure as seemingly innocuous as a trim. Nail trims are also done with the Dremel tool. You can restrain the bird, as we've discussed, but as you proceed, carefully extract one digit at a time to trim. The Dremel burr does a nice job of slowly removing the tip of the nail. The amount of nail to remove depends, of course, on how overgrown it is. It may be easy to see where the quick is on light-nailed birds, such as parakeets, but black-nailed birds will require practice and a sense of what the normal nail length should be. A hint as to when you need to stop on these nails is when the inner cuticle goes from being dry and flaky to having a moisture consistency. If you go too deep, the toe will bleed and hurt. The Dremel may stop the bleeding, but have some quick stop handy and apply a small pinch to the affected nail if it does bleed. Excess removal and bleeding will occasionally happen, but as your proficiency and experience increase, it will happen much less frequently. Wing trims are commonly requested to limit flight and may help birds avoid injury associated with flying around the house, possibly hitting ceiling fans or windows. You should, however, warn clients that wing trimming is not a foolproof anti-escape treatment and that going outdoors uncaged is inadvisable. Feathers may grow back quickly after trimming, or the right wind or level of excitement by the bird may allow the unrestrained bird with trimmed wings to fly away. Feathers, unlike hairs, do not grow constantly. Old feathers are replaced at molting when they fall out and are rapidly replaced by a new feather. This new feather has a prominent blood supply and is called a blood feather. Look at the difference between mature and blood feathers, noting the dark shaft of a blood feather. Never cut a blood feather, as this will likely produce copious bleeding. At times, a bird may be presented with several blood feathers, as the wing is molting the flight feathers. In this case, we tell clients that it would be better to wait a couple of weeks for the wing trim in order for the molt to complete. Trimming during active molting may become ineffective as the cut feathers are replaced by new full feathers. Also, the adjacent feather shafts tend to protect blood feathers from trauma and bleeding. If we trim a wing with a blood feather, we will leave the feathers on either side of the blood feather intact or long enough to provide protection for the blood feather. In the event a blood feather shaft is broken and bleeds, either during a trim or commonly at home, the bleeding must be stopped. Simply identify the bleeding feather, grab the shaft near the skin with hemostats, and pull it straight out of the follicle. Once the entire shaft has been extracted, use your finger to apply pressure to the follicle for a minute, and the bleeding will stop. A new blood feather will quickly grow back where that one was pulled. Feather shafts that are cut and not pulled will not be replaced until the next natural molt cycle. To perform a wing trim that is cosmetic and gives the bird enough wing left so it will not crash hard with flight attempts, the following procedure is used. Number 1, with the bird restrained, extend one wing. Number 2, leave uncut the last 3 primary feathers at the end of the wing and the first 4 to 5 contour feathers on the arm next to the body. 3, use suture scissors for small birds or white snail trimmers on large birds to individually cut the flight feathers. The feather is cut at the shaft, and you will need to move the small covert feathers aside to identify the shaft. Snip the shaft. There is no pain sensation or bleeding in a mature feather. 4, remember not to cut blood feathers and to leave a guard feather on each side of the blood feather for protection. 5, repeat this process on the other wing. And 6, you can offer the feathers to the client, who may collect them, or keep a stockpile to offer to children who visit your clinic. Notice how this cut looks natural when the bird is perching, as the feathers left provide normal shape.